Have you ever wondered what goes on inside of the radiology department of a hospital? Radiologists are medical doctors that specialize in diagnosing and treating injuries and diseases using medical imaging procedures such as x rays, CT scans, MRIs, nuclear medicine, PET scans, and ultrasounds. Now we go on to an interview with a radiologic technologist at Fleming County Hospital. Tell me about yourself.
My name is Savannah Workman. I am the lead CT MRI tech here at Fleming County Hospital. I've been here for 2.5 years.
What made you choose healthcare as a career path?
Actually, Miss Winston, whenever I was in high school, she was a radiologic technologist also, and I just loved her stories, so that's how it all started.
What is the most rewarding part about being a rad tech?
Just being able to help people. I love being able to give a diagnosis, and then we doctors treat and make people feel better.
How many years did you go to school?
4 years total.
What's the best and worst part of the job?
The best part is, again, like interacting. I love talking to patients, learning their history, and honestly, working here and being from here, I know just about everybody that walks in the door, but it is great to be able to help them. The most challenging would just be short staffs among hospitals. I feel like that's a pretty common thing. You do work hard, that's for sure.
Strangest thing you've ever seen in an x-ray?
I have seen foreign bodies, so, kiddos swallowing stuff, lug nuts, coins, whatever they can get their hands on. Those are my favorite.
The x-ray is one of the most common types of radio imaging. An x-ray works by a radiologic technologist using invisible electromagnetic waves to produce a photograph of the internal organs of a patient. The x-ray was created by Wilhelm Röntgen in 1895. Next, we have computed tomography, otherwise known as CT scans. They are used to generate more detailed images of a patient's body. These images are created by thin beams of x-rays that are aimed at the patient's body and are quickly rotated around it, producing signals that are then processed by the machine's computer to generate cross-sectional images or slices. Now, we have magnetic resonance machines, also known as MRIs. These machines work by employing powerful magnets which produce a strong magnetic field that forces protons in the body to align with that field. When a radio frequency current is then pulsed through the patient, the protons are stimulated, and they spin out of equilibrium, straining against the pull of the magnetic field. Next, we turn to nuclear medicine. Nuclear medicine is a method of imaging that detects the radiation from different body parts after a radioactive tracer is given to a patient. These images are then digitally generated on a computer and sent to a nuclear medicine specialist. These radioactive tracers are in most cases injected into a vein. For some of these studies, they are given orally. The amount of radiation used for these studies are minimal and do not pose any side effects. Next, we have positron emission tomography scans, more commonly known as PET scans. These scans are completed by a small amount of radioactive glucose that is injected into a patient's vein. The PET scanner then rotates around the body and makes a picture of where glucose is being used in the brain. Malignant tumor cells show up brighter in these pictures because they are more active and take up more glucose than normal cells do. Next, we move to sonography. Sonography, also known as ultrasound, is used to non-invasively image internal organs, but a main use for it is to track the development of a fetus. Ultrasound waves are produced by a transducer, which emits ultrasound waves and detects the echoes that are reflected back. When these echoes hit the transducer, they generate electrical signals that are sent to the ultrasound scanner. Using the speed of sound and the time of each echo's return, the scanner calculates the distance from the transducer to the tissue boundary. These distances are then used to generate two-dimensional images of tissue and organs. The technician conducting the ultrasound will usually apply gel to the area being scanned to prevent any air bubbles forming between the transducer and the skin. These bubbles might prevent the ultrasound waves from passing into the body. Next, we turn to a second interview with one of the radiologic technologists at Fleming County Hospital. Tell me about yourself.
Crystal Humphreys. I've been working at Fleming County Hospital almost 25 years.
Why did you choose healthcare as a career?
For one thing, I like to take care of patients, and the reason why I chose radiology is I always like taking pictures, so I thought it would be pretty cool to take pictures of the inside of the patients.
What's the most rewarding part of your job?
I think since I do mammograms and ultrasounds, finding people's breast cancer and helping them through that journey.
How many years did you go to school?
I went to school for 2 years at Warhead State.
What's the best and the worst part of your job?
I think the best part, especially in a small town, is knowing the patients, or a lot of them you know the patients. But the worst part is also knowing the patients, because whenever somebody is really sick or they pass away, it's really difficult.
What's your greatest strength?
Greatest strength, I think that would be my relationship with the Lord and how He helps me through each day.
What's the strangest thing you've ever seen?
Strangest thing I've ever seen. Well, I have seen cerebral spinal fluid in a patient coming out the side of a patient's head.
Overall, the radiology department is a vital part of the hospital. If this part of the hospital wasn't available, many people would not be diagnosed with fatal conditions that could easily be treated if they were identified. The radiology department works in tandem with all of the other departments and hospitals to give personalized care to each and every patient that walks through their doors.